Hi, good evening. Today we're going to do an examination of the ankle and the foot, and this is my patient Clarice. Hello, Clarice. The examination starts with the patient standing, and in standing we are inspecting to see the alignment of the great toe, which has to be aligned with the first metatarsal joint. We're looking at the arch of the foot to see whether there's any pes cavus or pes planus. We're going to put to check and see once the fingers can go underneath here, it means that the arch of the foot is adequate. We're also looking to see whether there are any deformity of any of the toes. Turn around please. And inspecting from behind, we're looking at the Achilles tendon, and there is a normal 5-degree valgus deformity, which is normal. We're looking as well to look at the symmetry of the calf muscles, and I'm going to ask the patient to tiptoe. And tiptoeing, the valgus deformity becomes a varus deformity, and there is reconstitution of the arch. I'm next going to ask the patient to take a walk, and in observing her gait, a normal gait is where, can you please walk a few steps forward, turn around and turn back. In walking, the heel touches the ground first, and then there's a toe push off, and this patient has a normal gait. Can you please sit down? Asking the patient to sit. Again, we're looking at inspecting the feet, and we're doing it systematically from behind to the forefoot and the hind foot. We're looking at the sole of the foot to see if there are any calluses, in particular on the first, third and fifth metatarsal. We're looking as well to see if there are any obvious swellings over the lateral ligament complex and over the deltoid ligaments. And there are none. There are no swellings, there is no redness, there are no abnormalities. We're looking at the alignment of the toe with the first metatarsal joint, and that's pretty normal. We are inspecting between the toes to see if there are any evidence of any fungal infection known as tinea pedis. We're next going to do some passive movements. We have dorsiflexion, plantar flexion, inversion and eversion. On palpating, we're going to palpate the medially, we're going to palpate the calcaneus, palpate the deltoid ligament complex, the lateral ligament complex, posterior tibiofibular ligament, the calcaneofibular ligament, and the anterior fibular ligament. We're also palpating the talus, the joint, the talar joint. Okay, we're going to palpate medially here to determine whether there is any evidence of plantar fasciitis. We're going to check the integrity of the joints and stabilizing the heel in the cup of the hand with the forefoot on the forefoot. We're going to check the AP, do the anterior jaw test to check the laxity, if there's any laxity of the lateral ligament complex, and if there is a movement greater than 5 millimeters, you will think about this ligament being lax. In checking the subtalar joint, which allows inversion and eversion, if there is a greater than 5-degree movement, we would say that there is laxity of the subtalar joint. Okay. Now we're going to check the tibiofibular ligament with dorsiflexion and external rotation or eversion, and if there is pain in this area here with the tibiofibular area, we know that there is a damage in this area here. We're next going to do the squeeze test. Squeezing to determine if there is a high sprain and if there is any arch. The level of pain is going to tell us what the level of the injury is. We're also going to palpate the retrocalcaneal bursa, which can cause pain if on palpation. We palpated the navicular bone as well as the cuneiform bones and the cuboid bones, the metatarsals and the tarsals and the metatarsal bones. We're checking to see whether there is any pain or metatarsalgia in the presence in the intertarsal bones, metatarsal bones, you can have the neuromas existing. There are no neuromas there. Okay, right, and the phalanges. Right. Next we're going to do a neurovascular examination, checking for the dorsalis, checking for the posterior tibial artery, the dorsalis pedis, as well as the capillary refill time. Okay, we're going to check for that concludes it. And in our neurological examination, we are going to check for light touch with a piece of cotton. Do you feel this?
Yeah.
Can you close your eyes and tell me, say yes when you feel it?
Yes, 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 yes.
We're going to check the pinprick. Do you feel this?
Yes.
Every time you feel that, can you please say yes?
Yes, 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 yes.
We're also going to check vibration sense. Can you please, do you feel that?
Yes, I do.
Can you tell me when it's finished?
It's finished.
Yes, correct. As well as we're going to check proprioception by stabilizing the distal interphalangeal joint. This is up, this is down. Close your eyes. Can you tell me how is the toe?
Up, down, up, down.
Next, we're going to check part of the neurological examination can be the movement of the foot, the great toe. Can you bring the toe towards you? Right? 30-degree flexion is expected. Can you put the toe down? At least nothing less than 70-degree extension is expected. Okay? And now I will ask the patient to lie down. What are we going to do? Lie down on your tummy, please. We're going to do the Thomas test, which tests for the integrity of the Achilles tendon. On squeezing the calf, a normal plantar flexion is observed, which means that they have an intact Achilles tendon. And thus concludes the examination of the foot and the ankle. Thank you, Clarice.